My name is Melvina Parker. I am a student nurse practitioner, Florida National University. Today I will be performing a head-to-toe assessment on a patient. I will explain to you what I'm doing as I'm doing it, as well as explain to my patient. And we're going to start. I washed my hands already, and I'm going to start by introducing myself to my patient. Hi, my name is Melvina Parker, and I'm a student nurse practitioner. And I would like to do a head-to-toe assessment on you. Is that okay with you?
Yes.
Alrighty. Sir, can you tell me what your name is?
No Muhammad.
And your date of birth, sir?
It's March 7th, 1981.
Okay, can you tell me who the president is?
Donald Trump.
Okay. Can you tell me what day of the week it is?
It's Thursday.
Okay. Sir, I'm going to do a head-to-toe assessment on you. I'm going to take your vital signs, which include your blood pressure, your temperature, your respiration, okay, and your pulse. And I'm going to start with your blood pressure. And we have 122/76. Gonna do your pulse. While I'm doing your temperature, gonna put this in your mouth. You're gonna put this under your tongue. Close your mouth. Hold on to it. Okay. I'm gonna do your pulse. We got a temperature of 98.7, and we got a pulse of 84. And wash my hands again. I am now going to inspect your skull. I'm looking for lesions. I'm looking for any abnormalities, any indentations, or anything like that, okay? Let me know if you're having any pain. Are you in any pain today, sir?
No.
Okay. All right. I'm gonna start with your scalp. And because Mr. Muhammad has a beard, I'm also going to check inside of his beard. Okay, thank you. All righty. I'm going to take my gloves off and wash my hands again. I'm going to inspect his temporal artery, temporal pulse, which is here. I'm also going to inspect his mandibular joint. I need you to open your mouth. Close it. I'm listening for if there's any clicking sensation, and there's none there. Now we're going to check his ears. Can you turn to the side for me, sir? Because we're going to check his ears one at a time. And we're going to pull up and back. And we're going to look in, see if there are any nodules or anything in his ear, in the back of his ear, and there are none. We're going to do the other side. Canal for any nodules, any on the back side, and there are none. I'm going to close one ear off and whisper something and ask him to repeat it on the other side. Apples, oranges, and pears.
Apples, oranges, and pears.
Very good. Okay, I'm going to do this. Apples, oranges, and pears.
Apples, oranges, and pears.
Very good. He was able to hear. I'm going to ask you to put this paper on one side of your eye so that I can examine it. You can put your hand over your eye, or you can use this, which makes you.
That's not
Okay. So put it over one eye and look me directly in the eye. Okay. How many fingers?
2.
All right. Change eyes. How many fingers?
3.
Okay. Very good. Thank you. I'm going to examine your eyes, your eyelids, your pupils, your sclera. Okay. Just open your eye. Open your eye. Relax. Okay. Very good. And you can see it's nice and pink inside. Now I'm going to do the other eye. Eyelids are even. Sclera is white. There is pink down here, which is a good sign. Face is asymmetrical. There's no drooping on one side as it is with a post-CVA or Bell palsy. And he's good. Now I'm going to check for dilation. Okay. Both people's dilation should be anywhere between 3 and 5, and his is about a 3, which is good. About 10 centimeters in front of you. I don't want you to move your head. I just want you to follow his pen light as we go, okay?
Yes.
Without moving your head. And we're going to go right, left, up, down, up, down. Very good. Your eyes aren't shaking or anything, and that's a very good sign. Start palpating the lymph nodes. And we're going to go first to the pre-articular, the post-articular, the occipital, the parotid, the jugular, the submanual, submanclavicle, and we're going to go down to the deep subclavicle chain. You feel any discomfort, any pain?
No.
Okay. And then we're going to go to the preclavicle and the superficial clavicle. We're also going to take a look at his trachea. And what we're looking at with the trachea to make sure there's no nodules and there's no deviation in it. That is asymmetric, going straight down his throat. I'm going to ask you to hold your head back a little bit. We're going to palpate it. I'm going to put my hands each side. Any discomfort or any pain?
No.
Okay. All right. I'm going to ask you to turn your head to your left and to your right. Okay. Very good. Okay. Now we're gonna check the thyroid glands and the carotid artery. Okay. 2+ bounding, and that's good. I'm gonna place my finger on your neck while you swallow. Okay, any difficulty, any pain?
No.
Okay, I'm gonna listen to your chest and your breathing for the next minute. Okay. With your mouth open. Okay, one more time. Good. Your mouth and breathe. And breathe. Stop. Very good. His breathing is good. His lung and his chest goes back out. I can't feel any rattling in his chest at this time. His diaphragm on his left side. Okay, on his right side. Lungs sound very clear. On the left side, no nodules. On the right side, no nodules. Lift your arm up. No nodules. This arm. No nodules. Okay. Carotid artery on both sides. Very good. The 5th intercostal space. Very good. This is where you get your apical pulse. Now I'm going to go to the 2nd intercostal space. This is on the right side. 2nd intercostal space. On the left side. And now we're listening to the tricuspid valve. Palpate this area by putting our palm on the back and thumping. Okay, that's good. Stop. See if there's any deformities, any nodules, any swelling in the joints. Any clubbing? Any pain or discomfort? Okay, let me do this hand. There are no nodules, no swelling at the joints. Can you do your hands open and close for me? Like that. Thank you. And now, test that is done. And that's where we take and put the patient's hand on the table and we tap all the way back up to the elbow. We ask the patient if he's having any pain or discomfort. Are you having any?
No.
Any of the joints? Okay, the other one is I'm gonna ask you to put your hands together for 90 seconds like that. At 90 degrees for 60 seconds. Okay? Out range of motion. Need you to put both of your hands above your head. Okay? And then place them on the small of your neck. Good. Very good. Very good. Now place them behind me like this. Very good. Very good. Okay. Now I need you to stand up. Okay. Good. Now I'm going to do the other side. Good. I'm going to ask you to bend over and touch your toes. Okay, stand back up. And I'm looking for asymmetric deviation in the spine area. I'm going to ask you to bend your head back and forth as far as you can down. Okay? Then left to right. And try to put your ear as close to your shoulder as you can. There you go. There you go. There. You're now going to check. You're now going to check his patella and see if there's any edema there, any fluid or anything. And the test is, I put my hands on it. No indentation. Can you bring this leg up? Back. Any pain? This leg out. Back. Any pain? And there's no swelling or fluid, no. Both of them. And both eyes. We're now going to perform the Thomas test. And what the Thomas test is, sir, you're going to take your knee, going to take your hands and pull your knee up to your chest. All right? Any pain or discomfort?
No.
The other side? Any pain or discomfort?
No.
And with cranial nerve 7, I'm going to ask you to raise your eyebrows, put them down, close your teeth, blink your teeth, smile, open your eyes, make puff both cheeks, say hello.
Hello.
So we know that's intact. 10, we're going to ask you to say ah, and I'm going to take a look. Ah. And this gagging reflex is good. So we know that that cranial nerve is working. Number 11, and what I need you to do is shrug your shoulders against my hands, rotate them. Now we know that that nerve is working. As I'm turn around and go back the other way, please. Okay. There's no limping or favoring one side, so his gait is good. You can have a seat now, sir. Put his finger to his nose. And the other hand, put it down, the other hand. Coordination is good. He's not swaying back and forth or from side to side. Range of motion to the side. Linda, very good. Very good. Now, your knee flexed, extend and flex, extend and flex, extend and flex. Range of motion is good. put his finger to his nose. Put that down, the other hand. Coordination is good. He's not swaying back and forth or from side to side. Turn around, one back the other way. Okay. There's no limping or favoring one side, so his gait is good. You can have a seat now, sir. Number 11. And what I need you to do is shrug your shoulders against my hands. Rotate them. All right. Now we know that nerve is working.